Dr. Scott Haggerty. This is Dr. Matt Stevens. We're here with BE-ELITE.org. We are here today at Elite Training Performance in Medina, Ohio to interview strength and conditioning coach extraordinaire, Luke Chronister. We are here today to discuss starting youth athletes into strength and conditioning programs. So Luke, let's just get started. What do you consider to be a good age to go and get youth athletes started in strength and conditioning programs?
Well, usually when we have youth athletes starting programs, it's usually ages 8 or 9. They're getting into soccer or baseball or some of their sports. So that's when we've decided that is a good time developmentally as well as for their needs to start doing a strength conditioning program. So depending on how much they're doing with that, that's a great time to start getting some of the fundamental movement stuff ingrained in their bodies. Their movement patterns are set.
All right, so Luke, what's some different ways that boys and girls train for their specific sports?
Well, a couple things that are different between boys and girls as they develop. Girls are going to have a greater Q angle as their hips widen to just their gender differences for childbirthing and other things. But boys will not have that same process, so they don't have as many problems with hamstring or ACL injuries based on that Q angle. So when we're addressing female-male differences, a lot of it is posterior chain strength for the females so that they can stay balanced and help reduce that potential for an ACL injury.
Luke, you work with a great number of athletes. So, and obviously you have people that are coming in at different points in season. So what are some of the seasonal variations in training programs that you work with?
We like to work a lot on transitional training for our athletes. So we have a lot of multi-sport athletes, kids that will play football and basketball, or girls that will play soccer and then sometimes volleyball at the same time, or they're going to cross country or even softball. So when we have a transitional athlete like that, we want to take and make those last 3 or 4 weeks, maybe even a month before they get into their next sport, because we've been building up for the peak of their current season they're in. We want to go ahead and work on things like, so if we have a soccer player that's going to be going into, say, softball in the spring, we're going to then start transitioning them into their sub-scat program, so scapular retraction, depression, work on some more rotational core stuff, start engaging their lats and getting their shoulders set so that when they hit that high demand of throwing and hitting, their body's able to handle that workload when they get into their spring sport.
Oh, that's great. Thank you.
All right, Luke, so you work with a lot of athletes while they're actually in season too. So how do those training programs differ while they're in season and throughout the different demands of the actual coaching staff that they may deal with?
Yeah, and so a lot of our kids that are in season, they have various things they have to do for the coach. They have speed drills, they have strength, they have their skill development. So one of our sports, like say lacrosse, for instance, they might be doing a lot of running in lacrosse. And so for us, we're going to be working on keeping their muscular balance. We're going to be working on some of their coordination skill, and then keeping their body balanced anterior, posterior, bilaterally too. So we want to make sure that they are equally balanced, and our strength programs are going to address that in season. Now, we take into account the volume of training they're doing. So if they have 6 practices a week, they're obviously not going to do 3 or 4 days with us a week. We reduce that down, maybe showing our intensity or shorten our volume of training, depending on when they're at in their season and how many games they have in a week.
Okay, so basically what you're really focusing on is body maintenance, proper rehabilitation, and then maintaining performance while they're in season.
Correct, yes.
Fantastic. It's a great approach. So Luke, we know that it's important to get as much information as possible about your athletes. And in our practice, we do a lot of assessing with our patients from a sports rehab perspective. So in your practice, what role do assessments play when you are having a new athlete that's coming into training?
Anytime we have a new athlete come in, we'll do a few tests. We'll do our functional movement screening. We'll do baseline tests, vertical, broad jump, 20-yard dash, and then 5-10-5. So we get all facets. We get vertical power, linear power, lateral speed, and then linear speed. So those are some of our baselines. And then we can do a single leg touch, single leg cone touch. We'll do a single leg balance test. We'll do a plank test. Depending on where the athlete's deficiencies lie from some of our other tests, we can either add or take away. But we make sure that we pre-test them at the beginning of their season. We test them before they leave for a season, so that we know that we're recording gains or losses depending on what they're getting and where they're at, whether it's weight or body fat or whatever we're working on. So those are some of our assessments we do, and we'll assess those and add those in and out depending on an athlete, their season variance. So.
You've mentioned that you use the functional movement screen. We also use the functional movement screen in our own practice. Can you explain to folks who are not familiar with what a functional movement screen is, what value that adds to you when you're assessing?
Sure. Well, Greg Cook obviously developed the functional movement screen, and so it's 7 tests, and it gives us kind of a movement analysis for me on a more basic level than what you guys do. But where I'm looking at asymmetries bilaterally, we're looking at anterior-posterior imbalances, we're looking at mobility in hips, IT bands. It allows us to just see a picture of the athlete and say, here's where they're starting, and then we can determine based off that kind of what they need and how I can get their program to match up with that based off musculature, based off of flexibility, range of motion, any of those things. So it can give us some shoulder ideas. Do they have proper scapular retraction? Do they have any girdle problems? Do they have any immobilities there too? So it's kind of the best picture, in my opinion, just to see what's going on with your athlete on a daily movement. So
Yeah, that's wonderful.
I like to think that it just allows that picture to start. Everybody has dysfunction of some kind,
Yeah.
and the more you play a specific sport, the more that dysfunction leads. Whether it's functional for your sport, but dysfunctional maybe in terms of another sport or daily movement. And so,
And also for your athletes to decrease risk of injury is one big thing too. So it's key for that as far as maintaining or reducing that risk for the athlete in and out of season.
Yeah, I like what you said about giving that snapshot. I think for one of the biggest values that we find is it is that snapshot as to how they're progressing, and even through treatment plans with us, so that we can gauge, are they hitting the functional goals on the rehab plans that we had intended for the athletes, and then to see if they are regressing quickly and we can make quick changes. Do you apply it in a similar way with your athletes?
yeah, we'll redo that every now and then depending on where they're at. And obviously, like every day we do an assessment in their warm-up. Do they have tight hamstrings? Do they have movement deficiencies based off of, maybe they had, sprints yesterday, like full field. Maybe they had 20 full fields yesterday at practice, and so their hamstrings are tight today. So we'll adapt some of our mobility stuff that day to then address some of those issues, even though it might be a quick fix for the day. But it's going to allow them to get back on that recovery and repair and mobility so that they can then perform again. And so I like to think of that, like the FMS, as that snapshot. And they're not all going to look the same. They might have similar problems or different ways. And then our solutions are different depending on each person because they take different kind of courses sometimes to get the results. So they might look the same on paper, but then when you do the actual development and design of the program, it's totally different. So it's good.
Yeah, great information. So Luke, you were talking about some of the assessments that you use with your athletes. So we wanted to actually get some demos on some of the assessments that you use. So what you had mentioned is you use a plank as one of your baselines. So why don't you demonstrate for us how you use the plank and what the value is to you and what you see?
Sure. When we start with the plank, we want to make sure they have neutral spine, they're able to brace on their toes and elbows, that they also have a neutral head position, and then obviously from top to bottom, they're in a nice straight line. So I can demonstrate that.
Sure, that'd be great. So let us go ahead and get out of the way here. You can go ahead and show us.
So when we start with the plank, we want to start elbows and toes, nice and flat, shoulders are over elbows. A lot of times you'll get an anterior tilt, or you'll get somebody that lifts up or pushes back with their shoulders because their core is not able to brace. So getting into this position is oftentimes a little hard for people. So if we have problems with the plank, a couple things that we can do to help them. A couple things we help them do to brace or increase that pressure. We want to talk about that inner abdominal pressure where they create bracing. So to take that arch out, we'll have them start on their heels and have them just get used to tilting their pelvis up and pushing that back flat. So they'll just arch and tilt. And then whenever they're able to maintain that without using their heels, we'll let them just hold and we'll work on diaphragmatic breathing. So we'll have them breathe in and hold, and then we'll have them breathe out slow and keeping that pressure.
Hey Luke, I'm going to have you digress for 1 second into diaphragmatic breathing. Because this is something that we see oftentimes as dysfunction, a lot of people that we see. Just quickly discuss how important it is to have diaphragmatic control in a bracing.
Yeah, sure. So when people have, when they're bracing or they don't have diaphragmatic control, what happens is they create actually instability in their core. So their transverse abdominis turns off, some of their internal external obliques turn off, or they have just dysfunctional pressure and control of those musculature. So when they try to breathe, they actually suck their bellies in, or people tell them to pull their bellies to their back, which doesn't create any pressure or stability. And so what we want to do is teach them to brace or create pressure within the diaphragm and in their abdominal cavity so that they can have pressure and stability there. So we want to teach them to be able to breathe while they control that, because if you can't breathe while you're moving, you're not going to be able to move for very long. So we want to try to teach that breathing and that pressure where we're going.
Great.
So once we get that tilt down, we're able to tuck and tighten. We usually have a coach work on just making sure that they're engaged in the TA, making sure their internal and external obliques are engaged, and then make sure that they can hold. Take a breath in, and as Scott calls it, the baby belly. So they'll get a little baby belly there. And then they'll have just breathe out slow. And then we'll have them hold for a second once they get there. And then we'll have them count up to finish out that breath. So they'll go finish whatever air is left. 1, 2, 3, 4, and relax. So we can do a series of that. It's also often we prescribe that as homework for some of our clients that have a lot of that instability and oftentimes weak core control. So that's our first part. Once they get that, we go into something that's called a dead bug ISO. So we go into then bringing knees and feet up. So now they have less stability. Their legs are off the ground. And then they're just going to push together and create the same flattening effect of their actual lumbar spine. So they can breathe, hold, tighten, legs relax, and they just push together and hold. So there's obviously higher progressions from that, but those are some of the first starting points that you can do. You can also get even more specific to that core. You can go into just called a bear position, where you just lift, raise, and flatten. So you just come down. You can feel them get a little pressure in their core, and just lift the knees off the ground, and their abs have to engage to hold their body up. So those would be our first three, some of our starting points.
Those are great starting points. And I think part of the beauty of what he's doing with his assessment is he's making sure that before the athlete is actually starting to go and do complex movements, they have basic core control. Because one of the things that we always talk about in our practice is people who have energy leaks. So if you don't have core control, you have tremendous amounts of energy that you're leaking, which will lead to overuse injuries to some degree and at some point in your athletic career.
And I like to think of, when he talks about energy leaks, think of having, a gas tank that has a leak in it, and as you're driving, you fill that up, you're going to have less gas to actually go where you were supposed to go. So as an athlete, you have to produce more power, more force, and use more energy than you would need to complete the same amount of exercise as somebody that doesn't have as many leaks. So you have to work twice as hard, which then makes you inefficient and makes you fatigue quicker, so that at the end of a game, you're more tired just because of your anatomical alignment.
Yeah, that's a great point. And one of the things that is always concerning is if kids don't have this foundation, starting from young, they develop these dysfunctional movement patterns, which will then predispose them to injuries at some point in their career because they didn't learn to go and keep the joints in the right position, engage the core. I mean, as I'm sure you see, we see lots of kids that come in with back injuries at young ages, different joint injuries, and all of these, if you train properly, can greatly reduce those risk factors. And starting with core control, I think, is the most essential place for anybody who's beginning sports to begin.
Thanks. Yeah, we totally agree with that statement here at Elite, and that's why we say when kids start doing their sports, when they start having organized practices or organized training, that's when we start working on their movement mechanics so that we can help with anything that they might be getting overuse-wise, so we can balance that out for them.
Great. So Luke, what are some other assessments you like to do with your athletes that you could demonstrate for us now so you can kind of get a better window as to how they move and the quality of their movement?
Sure. One thing we do is a single leg cone touch. I'm going to do it on the RX pad today just because it's a little less stable and I like to challenge myself. But we'll go a single leg cone touch. We're going to come down. We're going to try to touch straight to the side and come straight back up. Now we want to watch for valgus knee collapse. We want to watch for flexion of the spine. And we want to make sure they're staying nice and tall. So they'll just go straight down. I'll sometimes have them roll their shorts up if they're long. And then you just come down, have them touch, and then come straight back up. So obviously if they can't do it on the pad or on the ground, we can move them down to something easier where they can go down, touch, and come back up, and down, and touch, and come back up. So some common problems are they'll have valgus knee collapse, they'll have spinal flexion, so they'll come down and they'll just lean over, so they don't actually have that hip stability, and they don't have that strength in that leg to be able to get low enough. Or they don't have ankle mobility. So those are all things we'll see there. Depending on how they move, will tell us kind of which place to go next.
That's a tremendous assessment. And I oftentimes, I'm sure Dr. Matt can second this, one of the things that we see is kids who are going under load too early. So getting into weight training programs when they don't even have basic body control like that. Is this a common problem that you experience?
Yeah, we'll have kids even middle school and high school that we have to go back to things like a cone touch so they can redevelop that hip hinge and that actual flexion in their hips and get some of that movement so that they can actually then do their lifts like a squat. And I love kids that squat heavy. I think it's awesome. But if you don't do it right, what's the point? Because then you're creating dysfunction. You're creating improper movement patterns, and it's not going to help them be better on the field. It looks cool to all your friends, but it's not going to actually transfer over to being better on the field. So a a lot of times we have to fight the egos and get into something like we have to do a cone touch and some balance work and then some core control. And that's often hard for people because it's not heavy and it's not weight bearing and it's not adding any load. And then once they get into our program and they do that for a couple weeks or a month and they've got this movement down and they're like, oh my gosh, and they go back under the bar and they can squat more than they did before and you haven't touched weight for 2 weeks, it's awesome. So that's one of the most probably exciting things that I see is without touching and adding more load, you can increase load.
That's tremendous. Learning to groove proper movement patterning young in these kids is so valuable, and I think the approach that you take by making sure that they have the appropriate level of control, motor control, and joint position before they start putting themselves under load, and not being afraid to regress. I think a lot of people are afraid, like you said, of hurting their ego by taking a bar off their shoulders by learning to go and do something like the cone touch in a single leg squat position. I mean, the risk factors that a lot of these kids are developing with the valgus knee collapse, the different potential injuries just because they have improper mobility and poor stability gets so much higher, especially as they start actually putting themselves under higher levels of load when they can find ways to become stronger and move quantity of weight with poor quality.
Right, yeah. And so another example, some corrections we do for when somebody has a valgus knee collapse there would be, we do a couple different things. You could have them do a knee band where they put that actually around. And thank Rogue right now for these, 'cause they're really nice. But you just have them start out, and when they do their squat, they can go into a squat position. You can do half clam to work on just glute med activation. And then you can do a full clam where they do both. You want to make sure the big toes are staying down, chest is up. And then you can have them squatting with the band just to work on depth. So we'll do something where it's a little more reactive, or where you give them a cue and you say drop. And you can see if they can drop, chest up, hips, knees, and ankles in line without shooting their toes, their knees over their toes, or without bending forward, or without any valgus knee collapse or arch collapse or external rotation of the feet. So those are a couple things that we'll start working on then. And then we get into obviously some side lunge work or monster walking where they're just forward and back working on grooving that pattern. So those are some correctives we do after we do our single leg cone touch assessment.
All right, we were talking about some of the differences between training boys and girls. You kind of mentioned that the females tend to have an increased Q angle, and you do a lot of posterior chain work with them. Can you give us a couple demos of some exercises or just some of the activities you incorporate into their training sessions to address those issues?
Sure, especially when we start very basically without adding much load. A couple of things we want to focus on are the glutes and the hamstrings. So eccentric hamstring strength as well as just the posterior chain together and that insertion of the glute and hamstring region. So the first thing we would do is we work on like a buck series. So when you have just a simple band, you can use TheraBands around the knees or something that's connected already. But I like to give them this just because it helps activate the glutes and it gives them proper alignment of their knees. Because without a medial band, you'll get people that have valgus collapse even when they're doing a buck on the ground. So to activate the glutes, have them raise their toes, drive their heels in the ground, and then really activate the glutes. So pinching a quarter with your cheeks or lifting and bridging up and keeping pressure into the band. So they'll come up and down. And you can obviously hold iso first, and then you can alternate sides where you lift one leg and hold without having any hip collapse, as well as keeping the toe dorsiflexed. And then you can go arms up. This makes it a little less stable. And then you can go into actually concentric movement, or you can go eccentric, 1, 2, 3, down, up, and 1. So those are more glute based. A little bit of hamstring work in there. And then when we go into our hamstring work, we want to go ahead and go sliders. These are simple. You can get them at Home Depot for a couple $, and they work well on carpet or hardwood. So again, same position on your back, toes up, dorsiflexed. Make sure your heels are in the middle, and then you come up. These are eccentric hamstring slider curls. So you go out 1, 2, 3, keeping the glutes up, and then you can go ahead and relax down. A couple common things that happen here. People lose their dorsiflexion. They also start to then get an anterior tilt because they don't have the core control once they get up. So make sure they can hold this position here, and as they go out, 1, 2, 3, make sure that they're not arching their back way up in the sky, that they're still keeping straight. So as they go out, 1, 2, 3, and then they relax down. So we want to take that tension off on the way back in because we're only working on that eccentric phase on the way out. So those are a couple of our posterior chain beginning points.
Those are excellent. Those are good. Actually, for a lot of your younger female athletes too, to start to reduce the risk of ACL injuries at a young age, improve hip function, and also stability. So those are great key points and some great exercises.
Thank you. Yeah, I find that especially with sports that are running a lot, that are jumping a lot, and in the female population, when they have a lot of that quad-based exercise, they're not working hip extension, they're not working on knee flexion, and they don't have that side of it in their sport. And so when they start losing that, that's what increases that that valgus knee collapse even more, and that starts to then change the way their body's working and then set them up more likely and increase their potential for injury. So some of those things are what we like to focus on, just to keep them stable, healthy, and on the field.
That's great.
Luke, we'd like to thank you very much for giving us some of your time today. I know that you have a very busy schedule, and we'd like to give you an opportunity to tell the viewers here about your business and how they can contact you, because I'm sure that the folks after watching these videos are going to be very interested in learning more about what you do, your expertise, and I'm sure they'd like to be able to go and contact you for consults, maybe to work with you as a trainer. So would you mind telling the viewers a little bit more about your business and how they can contact you?
Sure. Luke Chronister, Elite Training Performance. We're at 3693 Pearl Road, Medina, Ohio. You can reach us at EliteTrainingPerformance.com. You can reach us at 440-832-0513. We're also on Facebook, Instagram, and Twitter. You can find all of our information there. And if you have an athlete or do athletic movements, so maybe you play tennis or you play other sports recreationally or you bike ride, we work with people of all ages on all their sports endeavors. And if you have questions or comments about anything, we would love to hear from you. And thanks for having us today, Scott and Dr. Matt. We appreciate you being here, and we look forward to continuing to help your clients. So thank you.
Thank you very much, Luke. And for those of you who are just watching our series for the first time, we send all of our athletic clients to Luke Chronister because he's the best that there is. We'd like to thank you very much for visiting BE-ELITE.org, and keep yourselves tuned in here for the next Ask the Expert segment that will be coming up soon.